All right, this next video that you guys are about to see is the tib-fib fracture. So basically splinting a long bone. It's one of the potential random skills you may get at National Registry. So I will be going down the list of a National Registry while I show you guys the skill. We'll be using padded boards. Hello everybody. I'm going to give you a little bit of a tutorial real quick about how to splint a hip. We're going to take it from the point where the patient's already on the ground. We already know what's going on. We've done a head-to-toe assessment, all of that. So we're just going to do skills only. Couple of things that we're going to talk about is the different ways to splint. We're going to have some different splinting material. Got to have plenty of cravats. You need a couple of splinting boards. This is going to be for the basic level, advanced level, paramedic level. There's some other devices we'll talk about, but we're going to show you this first. And then we also need a little bit of padding. BSI, of course, I call him a partner, Mr. Ahmad, to come on in. We've already done our head-to-toe assessment, and we realize this person has an injured hip, whether it's a fracture, dislocation. A lot of times what's going to present with that is obviously there's going to be pain, especially on palpation or movement. You may have one of the feet will be slightly shorter, the legs will be shorter than the other leg, and then sometimes externally rotated. That's not always the indicator, but that's a possibility. So I'd have my partner go ahead and hold stabilization of the hip, keeping the patient from moving while I get my equipment ready. One of the things that you do with an injured leg, unless you're talking about the ankle specifically, is you're going to go ahead and you're going to put this foot in a position of function. So you're going to do what's called an ankle hitch. There's a few different ways to do it. Remember, the key to splinting is to keep the leg from moving or the extremity from moving, to prevent further injury and also to relieve pain. So if you see an ankle hitch done differently than this, that's fine. There's a few different ways to do it. Always do an overhand knot, then I wrap around the top of the ball of the foot, come back over, and just nice and easily cinch it down until it's tight, but not too tight, of course. And then an overhand bow. I'm going to reassess for pulse motor sensory after that. Do it before and after anytime you make an extremity move. Before I put my pads into place, I'm going to go ahead and put a little bit of padding into the growing area. And underneath the arm, I'll bring my splints in. Your splints, one of them is going to be kind of long, the other one's going to be about medium size, right? You always want to make sure on your board splints that the padded side goes towards the skin. Place that right up to the crotch. This one's going to go all the way up underneath the armpit. Should have a few inches overhang. That's fine. Then you're going to take your cravats. Since we are going to be doing the hip, it would be ideal if you had someone else to hold the leg up while you run your cravats under, just to limit movement. If it's just you and your partner, sometimes you got to do what you got to do. I always try to do 2 cravats below the knee. And then I'm going to go 2 above. You'll notice here too that I'm just going nice and slow. Speed, a lot of times if you're trying to go too fast, you're going to cause more injury. So I'm just kind of laying them over. Now the tricky one, it's got to go through the small of the back around the hip. What you want to make sure of with this one is that you stay off of the abdomen. So I just take it, barely lifting up. The patient, push a bunch of it under. Then be beneficial if I had someone on this side, but we'll make do. All right. So now that I've got my cravats in place, I'll go ahead and begin securing Doesn't matter so much if you go from top to bottom. What does matter is that you tie off to the side. Doesn't matter if it's towards you or away. I just usually go away from me. You want to cinch it down until it's tight. Overhand knot's fine. Then I tuck the excess. You want to tuck the excess because you don't want that to get caught on something. And the reason why I tie it off to the side, whether it's this side or my side, is you keep the knot from being over the patient. When it's over the patient, you actually create a pressure point, so you want to try to stay away from that. Just tucking that down in there nice and easy. This one is above the knee. You don't want to ever splint over a joint. Try to stay away from that. Just trying to make it nice and snug. All right. And now the splint across the hip. The goal here is to basically create stabilization by giving slight pressure inward on the hip. Being able to pull that pelvic girdle together is going to, 1, reduce pain on movement, 2, it's going to limit bleeding. Once you have your splints in place, now what you would do is with your partner, you could tie the second leg, the other leg, into this one if you wanted to. Sometimes that may not be comfortable for a patient since we're talking about the hip. It's really going to be depending on the patient itself, but now we want to move it. So, moving the patient, I would recommend scoop stretcher. So you can let go of the pelvic now. What we're going to do is we're going to go ahead and measure this so we get the right distance. Holding right there. Open that on up. For those of you that couldn't see that from the camera angle, I'll hold this up a little bit so you can see. You have a release right here. Pull those back. You can extend this to the desired length. Flip that down. When you hear it click, you know you're in the right place. All right? Once you have your scoop stretcher measured for the length of the patient, little release button down there. Mod, if you would, sir. Yeah, that one's not in place. That's good, though. There we go. If you would, go ahead, take this to the other side of your patient. Take your scoop stretcher and you're going to get on either side of one another. Gently slide this in, going under the patient. Once you get them together, they click. Now what you'll see, Ma, if you would get on that end, squat, count of 3, 1, 2, 3. You can lift your patient up, take them over to the stretcher, place them down nice and easy. That's the best way to try to move your patient. One other thing real quick, just talking about hips. So this is obviously the best way to use your padded boards if you have these, but a lot of services are starting to carry what's called a pelvic sling. Works the same way, saves a lot of time. So I'm going to show you that real quick. Would you go ahead and disconnect that for me, Ahmad? We'll take them off the scoop stretcher real quick. All right. Pelvic sling. It's a pretty nifty little device. Just unrolls like such. It's got Velcro. Should work nicely under most patients. It's kind of a one-size-fits-all, but there's always exceptions. Go ahead and take this off the patient just to show you how the pelvic sling works real quick. So if your service carries one of these, what you would do is just line up to the patient. Doesn't matter which side you go from. On the count of 3, we're going to roll that way. 1, 2, 3. Slide that under as much as you can. 1, 2, 3. Down. Back your way. 1, 2, 3. And pull it out. Now, then you're just going to center it up over the hips. The goal is to get it straight across the center of the hips of the patient. You just feed the strap through the loop. When you go to pull tightness, what you're listening for is a click. Once you get enough pressure on it, it will click. Just like that. I don't know if you can hear that from here. Once it clicks, strap it down into the Velcro. Now you have your pelvis splinted. Works really well. It's hard to over tighten. Fits on most patients. So those are a couple of skills you could use if you have someone with a pelvic injury. Just remember, splinting, you have 2 main goals. 1, stabilize the injury so that there's not further injury. And 2, just trying to relieve some pain. Thanks. We're going to go on to the next one.